Ready,
Okay.
Freddie? Okay.
Go.
Knock, knock, knock. Hi, good morning. My name is Sally. I am a student nurse. Can I have you give me your name and date of birth for me? Nice to meet you, Mr. Jones. So I'm a student nurse. I'm going to be helping your nurse today. We have a head-to-toe exam scheduled. Can you go ahead? I'm going to ask you a couple of questions. Can you tell me where you are? Galen Hospital. And what brings you in today? That head-to-toe assessment for work. Are you in any pain? No pain. And can you tell me what day of the week it is? You're right, it's Monday. A couple more questions before we get started. When you're at home, how do you get around? Do you have a wheelchair or a walker? No. And cooking, driving, are you able to do those by yourself or does someone come and help you? Just by yourself, glad to hear it. We're not in pain, do you have any allergies? I see you have a red band on, you're allergic to iodine. Don't worry, none of that today. So I am gonna go ahead and get started. So with the head to toe exam, what we're doing, I'm basically looking you from your head to your toes. Gonna be listening to your heart, your lungs, your tummy, your pulses. I'm gonna get started up here. What your responsibility is to let me know if you are uncomfortable or feel any pain. I have provided privacy, so I'm gonna try to keep you as covered as possible. I am gonna go ahead and start up on your head. I'm wearing my gloves. When I'm looking at your head, I'm looking for symmetry, any lumps, bumps, bruises, any tenderness. Head look pretty symmetrical. I'm gonna palpate around your sinuses, any tenderness here. While I'm palpating around your sinuses, I like to do your lymph nodes as well. What I'm feeling for is any hard nodes that might be inflamed. They would be unmovable and kind of painful. So let me know if you're feeling any pain. Here's your preauricular, your postauricular, your occipital is right behind your neck, your jugulodigastric, here's your deep cervical chain, your mental, any pain or tenderness yet? No, submandibular, superficial cervical, and then right up here is your supraclavicular. All your nodes, I didn't feel anything, which is a good assessment. This is when I would do cranial nerves, but for now I'm just gonna get started in looking and inspecting your eyes. So I have a pin light, it's just a little light, as you can see. I'm gonna go ahead and put my pin light here. And I'm looking in this eye for pupil constriction and the opposite for accommodation. Can you look forward and follow my pin? And then we're gonna go keep following my pin. Here we go again. So pupils were equal and reactive to light and they accommodated. With your eyebrows, your eyelashes, everything looks good. I'm not seeing any missing hair. I am going to lightly press down underneath your eyes. I gotta look at your sclera and your conjunctiva. Everything looks great. No abnormal drainage. Do you wear glasses or contacts? No, I would just document that. For your nose, it's important that your nares are symmetrical. No foreign objects seem present. Can you go ahead and occlude one nostril and sniff? And again, so nose is patent. Taking a look in your ears. I'm not seeing any foreign objects or drainage. I am gonna lightly palpate your ears, your tragus for any discomfort. Looking for skin breakdown. For your mouth, say ah for me. So I'm looking in your mouth for any areas of patchiness. I wanna make sure your mouth is moist, a light pink. Teeth are intact. Can you say ah? Soft palate went up. I'm looking at your trachea, it's midline. This is a great place to also do your carotid pulse. So it's 2+ on this side and 2+ on this side. I'm checking for skin turgor right above your clavicle. No tinting present, so that means you're hydrated. I'm gonna go ahead and take a look at your arms. So I'm looking at your arms, I like to look at them both together. Bilaterally, I'm checking your temperature with the back of my hands. It should be warm, not too hot. I'm looking at presence of arm hair. I'm not seeing any lesions, tattoos, any wounds. Looking at your hands, your palms, your nail beds, looking for contour. It's a nice 160. I'm gonna check your capillary refill just to make sure we're getting some perfusion. Capillary refill looks good. We're getting 2+ on each hand. Your fingertips are nice and good hygiene is evident. I am gonna go ahead and listen to your heart and your lungs, and it'll move into your tummy and just keep moving down. with your lungs, I am gonna undress you just for a little bit. Have you had a cough or a cold recently? Glad to hear it. Stay safe from the flu. That'll do for now. So I have privacy. With our respiratory assessment, I'm gonna do that first. It's important to separate your abdomen and your chest into right and left quadrants for symmetry. So up here, we have your trachea being midline, then you have your angle of Louis, your suprasternal notch, and your supraclavicular notch. Angle, posterior angle, which lets me break you into right and left. So I have a stethoscope. When I move my stethoscope, would you take a deep breath in and a deep breath out every time I move my stethoscope? So I'm starting up here. Up here where you hear some bronchial sounds. So deep breath in. We're still listening to some bronchial sounds up here, just listening all over. Deep breath in, deep breath out. We're moving into some bronchovesicular sounds. Deep breath in, deep breath out. And finally, some vesicular sounds down at the bottom. Deep breath in. All right, lung sound sounded clear. I'm gonna go ahead and sit you up a little bit. So I'm gonna do the same thing in the back, but while I'm back here, this is a really good time to check for any signs of skin breakdown. So I'm looking at my patient and their back, starting up at the top of the neck. Looking to make sure the spine is midline. No signs of skin breakdown back here either. I'm putting my stethoscope back in. Same thing like I did in the front. Every time I move my stethoscope, just please take a deep breath in and a deep breath out. So I'm starting up here for some bronchial sounds. Deep breath in. We're just gonna serpentine all over. Deep breath in. Gonna listen over here. Bronchovesicular. Just listening all over, and then some vesicular sounds at the bottom. Great. All your respiratory lobes sounded clear. I didn't hear any adventation sounds. You're not using any accessory muscle use. So I'm gonna go ahead and document that our patient is having good airway right now. I'm about to cover you back up, but it's important for me to do a cardiovascular assessment on you as well. I've already done your carotid. I'll do your other pulses once we cover you back up. Putting my stethoscope back in. So in the right second intercostal space on the sternal border, you have your aorta, aortic valve, S1, S2 auscultated. On the left sternal border, second intercostal space, we have our pulmonic. A little bit to the left, we have our Erb's point in the third intercostal space in the clavicular line. Tricuspid is in the fourth intercostal space, left sternal border. And then the mitral valve is in that fifth intercostal space on the left sternal border. This is also the place for that apical pulse that I would listen to for a full minute. Cardiac sounded great, S1, S2 auscultated in all quadrants. I'm gonna go ahead and cover you back up and listen to feel your pulses. We already did your carotid, which I did one at a time. For the rest of your pulses, I am gonna do bilaterally. So you have your radial pulse right by your wrists, 2+, then your brachial, 2+. I am gonna go ahead and uncover your feet. I'm gonna keep you as covered as possible. While I'm looking at your hands and your arms, I do wanna test your sensory while I have you in this position. Just like with our cranial nerve number 5, here is our sensory Q-tip. We have a soft side and a sharp side. I'll show you again. Soft, sharp. I'm gonna have you close your eyes and let me know where I'm touching you and with what side. So soft on your inner arm, sharp on your elbow, sharp on your leg, soft on your knee, sharp on your upper thigh, soft on your foot. Great, so sensory for our upper and lower extremity are present. Continuing on with our pulses, we have your popliteal pulse right underneath your knee. I'm just gonna put my hands right here. Your posterior tibialis is right inside of your ankles. And then your pedal pulse is right by your big foot. I'm just gonna press down lightly. Great, all your pulses were 2+. This is a great time to be looking at your legs as well. So just like I did with your arms, I'm feeling for temperature bilaterally. I'm gonna make sure you're nice and warm, but not too warm. I'm looking for leg hair. It should be some, I am seeing presence of leg hair. I'm not seeing any lesions. I'm looking for skin breakdown, especially underneath the ankles. I'm also palpating for edema, not feeling any of that. Skin breakdown, not present, and then presence of edema. I'm gonna feel for some crepitus. That could be some cracking in your joints. I don't feel any crepitus. I'm looking at your feet really quick, and then I'll change my gloves. So our toenails are hygienic and nicely, the appearance is nice. It's not, I don't see any signs of fungal infection. Toenails are cut straight. Checking your capillary refill. Capillary refill, refilled within 2 seconds, which we like to see. I can go ahead and do your range of motion down with your feet. Can you go ahead and point, push against me, pull against me? Great. So I would change my gloves because I touched your feet. I do want to look at your belly, so I'm gonna have you lie flat for me. When was your last bowel movement? This morning, and what was it like? Did you have any trouble passing? No trouble? And what was the consistency? Solid or runny? All right. And you are a male, so I'm not gonna ask you about your menstrual cycle, but when was the last time you performed a testicular exam? Every month. Glad to hear it. So I'm gonna keep you covered for our belly. So the first thing I'm doing for your belly is I'm looking. I wanna actually lean down, looking at the contour, making sure it's not distended. There's no bulging, no masses that I physically can see. Are you experiencing any trouble or pain in any of your quadrants? No pain. So I've looked. The next thing I'm going to do is I'm going to listen. So I have my stethoscope. I'm gonna start in your lower right quadrant. I should hear bowel sounds every 5 to 15 seconds. Bowel sounds auscultated, moving up to your left right upper. Bowel sounds auscultated, left upper. And left lower. I heard bowel sounds in all 4 quadrants. Now I'm going to lightly press on your belly. Let me know if you feel any pain or discomfort. This is just that light palpation. Any pain or tenderness here? How about up here? Just lightly rubbing in circles. Left upper, no pain or tenderness. And then left lower. I'm gonna go a little bit deeper now for deeper palpation. So about 2 centimeters, 2 inches. No pain, no pain, no pain, and no pain. For percussion, it'd be normal to percuss and feel some of that tympany because your belly is full of air. I'm also gonna palpate your bladder. All right, that's it for our abdomen. I'll cover you up. I'm gonna do some range of motion. So I am gonna have you sit up just a little bit before I have you go get me a urine sample. I am gonna go ahead and bring your bed down, but I am gonna sit you up. So we already looked at your feet. For your arms, I'm gonna have you, just like with your feet, can you press against me and now pull against me? Can you flex your arms down, this way, this way? How about our shoulders? Can you spin your shoulders the other way? Any pain with that? For our neck, can you look up, down, side, side? For your hip, I'm just gonna lightly, I do need to uncover you because we're about to get out of bed. For your hips, I'm just gonna go lightly behind your knee and I'm just gonna push against. Any pain with that? No. How about this side? Just lightly pushing against you. No pain. So all your biceps, I've done your reflex, I've not done your reflexes. So we have a couple of reflex points I'm gonna be feeling for. I would do it to the other side, but for right now, I'm just gonna do it on the one, starting with your biceps. So with your biceps, I find your antecubital space. I'm gonna put my thumb here. I'm gonna ask that you go limp, and I'm just gonna lightly tap, tap. For your triceps, I'm gonna have your arm go limp. I'm looking for your elbow, and I'm just gonna lightly tap, tap. Brachioradialis, can you just go limp right here? We're finding your radius, and we're just gonna go tap, tap. I'm gonna test your patellar reflex. I could either have you dangle your feet off the bed, but I'm just gonna have you stay sitting down. I have the bigger side now. Tap, tap. And then for the Achilles, can you go limp for me here? And then right on the inside, tap, tap. All right, I'm comfortable with your gait and range of motion. I'm gonna have you go ahead. The bed is gonna be at the lowest position. I'm gonna have you sit off the bed and dangle your feet. You feeling dizzy? Not feeling dizzy, I'm gonna help them stand up. They're gonna walk to the bathroom. I'm watching their gait. It looks uniform. They're not wobbly. It's symmetrical movements. They're coming back. I left my urine sample. I'll go ahead and cover you back up since we're back from the bathroom. Any pain or trouble with that urination? Any burning? Glad to hear it. So I'm looking at your urine sample. Volume is appropriate. It's a yellow, which indicates good hydration, no sediments. So I would document my findings. All right, I'm washing my hands because I just touched urine. So I'm making sure your bed is at the lowest position. Is this comfortable for you? Just slightly up. Your call light is right here. Do you have any questions or concerns for me? Well, thank you so much, Mr. Jones, for your time. I'm gonna go document my findings, and I hope you have a blessed day.